But to prevent tearing, you can listen to your provider. And who was that who said that they just blew baby out? So making sure when you're pushing that you're controlling your push. It is a lot of pressure, it is a lot of pain, but if you just control it and just do little pushes, then most of the time, if you do some tearing, it's very minimal. And you usually don't even have to get sutured, because all sewing up the perineum does is brings the tissues together. And so if you have a straightforward tear and you keep your legs closed, what is that doing? It's bringing the tissues together. So a lot of doctors, they sew everything, but you don't have to sew all the time. It heals better that way.
And another thing to do before you even get to the pushing stage is listen to your body during labor. Let baby come down and descend on their own without the, just because you get to 10 centimeters doesn't mean you have to start pushing right away. If baby's still really high up, give baby enough time in your body to really bring baby down on their own. Baby does an awesome job stretching out all those tissues.
Yes.
The more time you give baby to do that, which in the end can prevent a lot of tearing.
And we don't have a lot of tearing. We can toot our horns on that. We don't have a lot of tearing. A lot of our moms are intact when they have their babies. And like I said, if they do tear, it's very, very minimal.
We don't do it. We can suture.
We are hands off. We're hands off midwives.
I just wanted to make a comment.
Sure.
Because that was one of my fears, having her. And what my best friend is a doula, and one of the things that she taught me was like to breathe. And I know it sounds weird. I feel like when you give birth, there's no such thing as a taboo topic or like a TMI. So what I did, sorry if it sounds really boring, but what I did was I practiced breathing while I was pooping while I was pregnant, and so that helped me, because normally when you push, you hold your breath and push. So if you practice while you're pooping, breathing it out, it makes it a lot easier. So when I had her, it felt really intense, and I felt like shit. And I was like, I feel like I have to poop. Can I go to the bathroom? Like, no, you cannot go to the bathroom. Like, she's working her way. So I just breathed through it all, and I was talking to her, and I was like, okay, and I am ready for you. I'm ready for you. And I just like breathed through it, and I didn't tear until like my last like big push. I was like, I'm over it. And I held my breath, and I just like breathed it down, like push, and she made her way through. But it was really minimal. I didn't even feel it, and then like I didn't even realize that my OB did suture me until I looked down, and I was like, oh, like I didn't even feel anything. So, but yeah, if you practice like breathing and like staying calm, yeah, that was like my
backing off for her. Those are the muscles that you use to push. Yeah, it's like you're pooping. A lot of people, one thing they do is they breathe when they're pushing. They use their face muscles. Don't use your face muscles. You want to use the muscles like you're pooping, because in your face you're just gonna get tired.
So don't have that. The other fear other moms have is I don't want to poop while I'm pushing. We actually see that as a really good sign, because that means you're using the right muscles and you're pushing in the right place. So don't be scared of that either. They just yeah.
They just clean you up like
You don't even know.
You don't even know.
We're like jeans.